We're seeing a lot of reports about hospitals in Canada, especially emergency rooms, under immense strain because of this spike in cases of flu, COVID, RSV. I'm curious where healthcare stands now as an issue for Canadians.
It's on the rise. Check out the 4-week change on top unprompted national issue concern in the Nanos tracking. Healthcare at the top of the list, 16%, up a full 3 percentage points in the last four weeks. Inflation at 15, up 2. Jobs at 15, down 4. Environment at 13, up 2. Not a lot of focus on the pandemic with coronavirus at 0.1. But what we are seeing is that an increasing number of Canadians are focused on healthcare as their top unprompted national concern. It's what they're worried about, increasingly worried about right now.
Now, in Ontario, at least, there's a lot of sort of public anger, I suppose, at the handling of our healthcare system. How did it get like this? Why is it under such strain? And I know that the Ontario Health Minister had to come out and say that it's not a way to push us towards privatization. There are long-term solutions that she's working on. I'm curious, who do Canadians blame for when our healthcare system comes under strain? Is it a federal thing? Is it the provincial government?
Oh, they're blaming everyone. How's that?
Everyone.
Yeah, it's kind of it's one of those things where the reality is that provinces deliver healthcare as part of their constitutional mandate, but the federal government plays a significant role in funding healthcare. So, and the thing is what we see is what we know from the polling is that there's been consistent support for publicly funded healthcare across Canada and consistently over time. It's kind of like part of our identity, and people always get a little nervous when there's anything kind of American style. And privatized healthcare is probably at the top of the list, which is why governments tread in Canada very carefully on when it comes to any perception of privatizing healthcare services, because they know that it can be a very risky strategy depending on what they say. So I'm not surprised that the Ford government is soft pedaling anything related to, I'll call it the P word, privatization, and connecting that to changes in the healthcare system.
And it was only just a few weeks ago, I think, that all the provincial health ministers in the federal government got in a room together and they were trying to figure out a new healthcare funding deal. The provinces would like more money for healthcare, and they didn't get anywhere. This seems like an issue that's only going to get worse in the next year.
Well, they didn't get anywhere because I'm not sure how much fiscal room the federal government has to give more money, and as a result, the Trudeau government hasn't been hot about engaging the premiers on healthcare and increasing the level of federal transfers. And you have to remember in this context that some provinces have surpluses. So it's kind of like, what's up with that? You've got a surplus. The federal government still has a significant deficit, and if from the federal perspective, if a provincial government has a surplus and it believes that it needs more money for healthcare, that perhaps because provinces also help fund provincial healthcare, that perhaps they should just be taking some of those surpluses and not necessarily delivering things like tax breaks and tax cuts to citizens in their province. So I think there's validity on both sides when it comes to the funding argument.
And do you see this as becoming more of a political risk for the federal government as we move along, or do you think this is just sort of a political issue that's been going since I guess for decades, and there's no end to it?
Well, the big question is this a bigger crisis than we have seen in the past? And I think what worries Canadians, regardless of what part of the country that they live in, is, when emergency rooms close, when they can't find a family doctor or have a general practitioner, and they have to go into either emergency or to clinics, that it creates a high level of anxiety that the healthcare services that people want might not be there. That said, I'm not sure that Canadians are convinced that spending more money is the solution. But we do know from research that's been done in the past that making sure that hospitals are staffed well, making sure that we have enough physicians in the province, and that our post-secondary education system creates the nurses and the physicians that we need, are probably top priorities. But the challenge with that is it's not a spigot. You can't just turn a spigot on and all of a sudden have more general practitioners available for Canadians. It takes time to create these folks. And I think the other thing we have to worry are physicians who, for their own frustration or for whatever reason, decide to leave, and nurses decide to leave Canada and go to the United States and to be in that other system.